paper tries to diagnose COVID-19 with just only cough recordings. A person can cough in the speaker of the mobile phone 3 or 4, it's a forced cough. Given this, it can actually determine whether someone has COVID or not. So it's essentially non-invasive. It almost costs nothing. You just need to install the app. It's unlimited throughput. It has around 98.5% sensitivity and 94.2% specificity. But the point is that it's actually pretty good because the standard PCR test, their performance is similar. So essentially, you have the audio, the forced cough, and they tell people to give 4 coughs, and they extract the MFCC features. So they essentially put 3 different models. These are ResNet 50. So these are like very high top level models for computer vision tasks, but they use it here. And for modeling your vocal cord, your lungs, and your sentiment, they combine all of them, and then at the end, they determine whether someone has COVID or not. This graph will just give you an idea of how the prediction is made, what's the source of the prediction, how different features are varying.
So we're going to go over the paper exploring the adoption of telemedicine and virtual software for care of outpatients during and after COVID-19 pandemic. What are the advantages of telemedicine? Convenience, like you just said, you can do it from the comfort of your own home. Why not? Operational costs. You don't have to go into the doctor's office. The doctor office doesn't have to put on a mask. They don't need to have a receptionist getting paid by the hour to get you into there. What are the disadvantages of telemedicine? What comprehensiveness? A doctor can miss out on those details. Doctors have been doing this for years upon years upon years. You're missing out on all those experiences. Also, the switching cost, getting people to go on a new platform, learn the software. Even startup costs are also an issue. Like you need to have the infrastructure of computers, network bandwidth. Sometimes you'll need to have special systems like for data privacy and data access. How can telemedicine and virtual software platforms be adopted for treating outpatients during and after the COVID-19 pandemic? What are they? What are the telemedicine and virtual software platforms that are adopted during and after the pandemic? What factors impact the adoption of telemedicine and virtual software platforms? No surprise, you decrease the time required to get a diagnosis, initiate treatment, stabilize. You get someone diagnosed with COVID, instead of bringing them into the hospital, you can check with a telemedicine. Clearly, like you reduce the movement of people, you minimize the risk of infection in general, particularly located around the hospital. We don't want the medical staff, the key responders, who are the biggest assets in this pandemic, to fall victim of illness.
And this is the paper behind the presentation. The paper proposes a conceptual framework, which was developed by several early career psychiatrists from 16 countries, covered all the WHO regions. And so this is one of the conceptual models that they propose. It's emotional epidemic curve to depict the possible change of people's emotional behavior in different phases of the pandemic. And this is the line of COVID-19 cases. This black line is the daily number of deaths. And this red line here describes the cases with mental health issues. And there are several major points in this curve. The first one is the first peak of the cases with mental health issues. It may be associated with inadequate communication, misinformation, and fake news. And also rapid growth of COVID-19 cases may cause fear, distress, anxiety, depression, sleep disorders, and lots of other mental disorders. And for some countries, there may be show a dipping point indicative of community resilience, the rapid reduction of distress after the first peak. However, there is also a second peak. So this can be unpredictable and complex, occurring due to the death of the loved ones, economic damage, and social disruption. The dominant effects may be post-pandemic disorders, including PTSD, depression, and relapse of pre-existing mental health conditions. And this paper also proposed a mental health preparedness and action framework. This framework is proposed based on the different phases during the pandemic and also categorized into different types of actions, such as planning and coordination, monitoring and assessment, and so on.